They're trying to gaslight us on mental health. Something subtle is happening in the national conversation. A new government report, Keep Britain Working, claims to address what it calls a crisis of economic inactivity caused by illness. But beneath the language of concern and reform lies something else. The report quietly shifts responsibility for mental health away from the government and the NHS and onto employers and individuals. The letter at the start of the report makes the dismissive statement that frustration with work, still less I hate my boss syndrome, are not health conditions. It warns that people who disengage from work or rely on welfare risk detachment and dependency. This says everything about the tone of the report. It implies that the real problem is not underfunding, not impossible workloads, not collapsing mental health services, but attitude. This is an extraordinary reframing of the issue. The NHS was created to provide universal healthcare, including mental health, but it's been starved of resources for decades. Waiting lists for therapy now stretch into years. Instead of recognising that failure, the report asks employers and workers to fill the gap. The message is clear. The state cannot afford to fix this. Employers must lead. Employees must show personal responsibility. And the government will simply incentivise the right behaviour. Mental health becomes merely an economic variable, not a human condition. Suffering becomes a productivity problem. This fits into a wider pattern in public debate. Commentators on the right increasingly claim that people are exaggerating ordinary stress, that mental health has become a catch-all excuse for weakness or laziness. The report reflects that thinking. It presents rising mental health claims as if they're partly the fault of the workers themselves. The report completely fails to explore reasons for these trends. It's a major omission. What if the rise in reported mental health problems doesn't mean that people have become more fragile? What if it means that they've become more honest? For generations, people were taught to repress emotion, to keep going, to bottle it up and carry on. That was good for productivity, but devastating for private lives. We're now living in a society where people are finally naming their pain. That should be celebrated as progress. Awareness has created a space for honesty, yet this report, like much of the current rhetoric, treats that openness as a social cost. The real problem is not that workers are too emotional, it's that work itself has become alienating. In modern capitalism, many people spend their lives doing tasks that feel meaningless, under pressure that never ends, for wages that don't cover the basics. Detachment and disengagement are not pathologies. They're rational responses to a system that treats people as expendable. If the workplace is a source of anxiety, exhaustion, and loss of purpose, the answer is not to lecture people about responsibility. The answer is to change the conditions that make so many unwell. There's also a deeper assumption that work itself is the cure for mental health problems. It's true that being active and productive can help us feel well. Human beings are creative by nature, and we need to express that creativity to stay healthy. But that's not the same as saying that employment in a capitalist economy automatically provides that outlet. For many workers, it means low pay, long hours, insecurity, and alienation. The kind of work that restores the mind is meaningful work, not merely paid work. It can take many forms: care, craft, art, community work, or study. Marx imagined a world where someone might hunt in the morning, fish in the afternoon, and write or think in the evening, not because he wanted everyone to hunt or fish, but because he imagined freedom, the chance to express different sides of our humanity. If we're serious about mental health, we need to think creatively about how people can live and work in that spirit. A universal basic income could provide the foundation for it, giving everyone a sense of security and freedom to choose how they contribute, to explore what they love, and to take time to recover when they need it. It would allow work to become a choice, not a compulsion, and creativity to become a right, not a privilege. When people feel secure and free, they're far more likely to be productive, engaged, and intentional in what they do. A healthy workforce requires a healthy system. That means funding the NHS properly, ensuring that mental health care is freely and rapidly available to all. It means building workplaces where people have autonomy, purpose, and security. It means recognizing that human beings are not economic inputs to be optimized, but people with emotional and spiritual needs. Even frustration with life can be real suffering if no one has ever taught you how to cope with life. Support is the answer. Compassion is the answer. And yes, that costs money, but the cost of neglect is greater. So when you hear people talk of keeping Britain working, ask yourself what that really means. Is it about keeping people healthy, fulfilled, and supported? Or is it about keeping the machine running no matter what it does to the people inside it? Real recovery can't be achieved through moral lectures or data-driven incentives. It begins with care, with honesty, with investment in a public health system that treats the mind as seriously as the body. If you enjoyed this video, please consider liking and subscribing. I'd really appreciate that. Thanks for watching, and I'll see you next time.